Good afternoon, and thank you for joining us for MemorialCare, Miller Children's and Women's Hospital Long Beach webinar in partnership with our chamber titled Returning to School and Sports. For those who don't know me, my name is Jeremy Harris, and I have the pleasure to serve as the President and CEO of the Long Beach Area Chamber of Commerce and happy to moderate today's webinar. We have three wonderful panelists that will be joining us today from Miller Children's and Women's Hospital Long Beach. Long Beach is one of only 8 cities in California to have a standalone children's hospital. We're so fortunate to have access to the latest pediatric healthcare right here in our very own community. Before we get started, I want to briefly review some housekeeping items. First, I'd like to note, since this webinar has started and it's about returning to school and sports for our kids and teens, the mayor currently, with education leaders from CSELB, LBCC, and LBUSD, along with our current city health officer, are providing a COVID-19 update at a current press conference as we speak. We're going to monitor that press conference and provide an update and share that out with the members and the registrants later today. Also, please note, this webinar is being recorded and will be distributed to the registrants and made available on the Chamber's YouTube page. Also, if you have any questions throughout the presentation, please use that Q&A feature or raise that hand feature down at the bottom of your screen so our panelists will have time to answer them at the end. I will assist with moderating those questions on your behalf. Now I have the pleasure of introducing our speakers today from Miller Children's and Women's Hospital. Dr. Torin Cunningham, Dr. Ioana Powell, and Dr. Interpol Randhawa. Allow me to briefly introduce each of them, and then we'll turn it over to each doctor for their presentation. First, Dr. Cunningham is a board-certified pediatric orthopedic surgeon and medical director of the Orthopedic Center at Miller Children's and Women's Hospital. Dr. Cunningham specializes in spinal deformity surgery, hip reconstructive surgery, and general pediatric orthopedic care. Welcome to you, Dr. Cunningham. Dr. Ioana Powell is a clinical psychologist at Miller Children's and Women's Hospital in Long Beach as well. She received her bachelor's in psychology with a minor in global peace and conflict studies. She received her master's degree in forensic science and mental health counseling, followed by a doctorate in clinical psychology with a forensics concentration. She has worked with children in foster care, youth on probation, children and teens with emotional, behavioral, developmental problems, medically fragile children, as well as adults dealing with substance abuse and dependence, marital conflict, adoption, physical and sexual abuse, and poverty. Welcome, Dr. Powell. And our third and final introduction is Dr. Interpol Randhawa. Dr. Randhawa has board certifications in allergy and immunology, pulmonology, pediatrics, and internal medicine. He serves as the medical director of the Children's Pulmonary Institute at Miller Children's and Women's Hospital, as well as program director of its Cystic Fibrosis Center, a role appointed by the Cystic Fibrosis Foundation, which is the world's leader in the search for a cure for the cystic fibrosis. We welcome you, Dr. Randhawa. As you can see, we have some very, very qualified individuals for today's webinar. So at this time, it's my pleasure to turn it over to Dr. Cunningham and allow him to begin his presentation. Dr. Cunningham, the floor is yours.
Great. Well, thank you so much for the introduction. It's really a pleasure to be here and speaking to everybody today. So we'll get my slide deck up, please. Great. So obviously, with everybody having the past year and change off from sports participation, I wanted to focus on what is this going to look like as we go back into school and back into sports on a regular basis, and how really the focus is going to be predominantly on preparation. Next slide, please. So as we get back into sports, you can see large numbers of kids are playing. We got up to 30 million kids around the US playing sports on a yearly basis, and almost 10% of those during the course of a year can sustain some type of injury that may require medical care. And especially in the 5 to 14-year-old group, about 40% may have a sports-related injury that requires treatment in a hospital setting. Next slide, please. So I think one of the things we've really seen as a result of the COVID pandemic is with remote learning, there's been no organized activities for the kids. There's no regular PE. So really a lot of deconditioning because kids have been kind of locked in at home, not doing regular exercise. We have seen a very significantly increased incidence of back pain complaints, neck pain complaints because of that decreased activity, poor posture as the kids are sitting at a desk or they're doing their schoolwork throughout the day, and really not getting out and doing normal kind of play activities. Additionally, the financial stresses of a lot of families not having adequate resources in terms of food or less nutritious food options. It also has a role as kids are getting back into sports and really needing a healthy, balanced diet. Next slide, please. So I think one of the things to emphasize is a big difference between kids and adults is that as they're getting back into sports, many of the injuries that for an adult we would kind of typically chalk up as a sprain, whether an ankle, a wrist, things like that, really don't happen as frequently in kids because their growing bones are different than an adult. So one of the things we can see, and if you look at the kind of arrows indicated on these pictures, is that children have growth plates, which is an actual cartilage area within the bone that their bones grow from. And that area ends up being actually weaker than the surrounding joint tendons or ligaments. So rather than getting a sprain, many of the injuries we see are actually subtle growth plate injuries. And the problem is if they're not recognized and treated accordingly, it can potentially lead to abnormal bone growth that may result in an angular deformity of the affected leg, or potentially even a growth arrest that may lead to the arm or leg being shorter than the other side. So I think one of the things to really stress for parents, coaches, as kids are getting back into their sports is that, again, the sprains and bumps and so on can certainly happen, but if it's something that's painful for more than 2-3 days, it is better to get it evaluated, get an x-ray, and make sure that this may not be a growth plate type of injury. Next slide, please. So again, preparation is really going to be the focus as everybody's getting back into sports. Again, with the low levels of activity, kids are not ready to go back into competitive sports immediately unless they've really done the preparation of conditioning, getting into the physical shape that they need to be for sports like soccer and football, where there's a lot of running. If they haven't been doing that in advance, they really need to start working now, getting ready, especially for fall sports coming up over the next 6 weeks, where we're focused in on conditioning. But then especially for, the older athletes and the teenage group, the coaches also need to be involved and really make sure that they're getting an adequate warm up and cool down for their practices and really focus on stretching. A lot of the teenage athletes that we see, they're going through rapid growth during those years. Some kids are growing 3-4 inches within a year. And it's very frequent that we see a lot of tightness in their hamstrings or other muscle groups. And if they don't work on stretching on a regular basis, they're much more prone to injury, especially hamstring injuries, or a lot more back pain is also related to very tight hamstrings. And frequently we have to get kids in for physical therapy to focus on that stretching aspect of things. And then just with any athlete, we need to really make sure that they're staying hydrated, getting adequate nutrition so that their body can heal and rest in between practices, games, so that they're ready to continue their activities. Next slide, please. So again, really conditioning prior to the sports season beginning. So any intensive sport, really the kids need to get started now and get that conditioning work in so that they're ready to play at their full capacity once the sport gets ready to begin in the fall. Obviously, it's been a very difficult year to keep kids active throughout the year with the pandemic, but now as we get back into hopefully more normalcy, the kids are going to be able to get into sports and PE on a more regular basis and stay more active throughout the year. And then one of the things we'll frequently see, especially here in Southern California, is there's a lot of focus on single sport athletes. And it's a very common source of overtraining or repetitive use injuries. So in general, we tend to encourage, especially for younger athletes, that they really participate in multiple sports throughout the year so that in between seasons, they have a chance to rest and heal and focus on different body parts that are emphasized with that different activity. Next slide, please. So baseball tends to be the most common one we see as a source of these injuries. And so year-round baseball has become very prevalent here in Southern California because our weather conditions permit it. But as a result, many kids are throwing on a much more regular basis than really they should be. And there's a lot of rules and regulations in terms of looking at pitch counts and things like that. But some leagues will follow these rules, but not all, especially if kids are on a more competitive travel team or things like that. And so, the current guidelines are that they should certainly not be pitching more than 100 innings within a year, because at that number of innings, they have a much higher risk, 3.5-fold of either shoulder or elbow injuries that they may sustain. And you can see, really common types of problems with 20 to 30% of kids having elbow pain in the 8 to 12-year-old group, but escalating to 45% in the earlier teens, and more than 50% of high school, college, and professional athletes having elbow problems because of repetitive throwing. And a couple of these pictures here kind of indicate up on the top evidence of what we call little league shoulder. So basically, because of the repetitive throwing stress, the torsion of the shoulder through the throwing movement, you can compare a normal growth plate in the upper humerus on the right picture versus the one on the left with a little league shoulder, where the growth plate, because of that stress, is actually starting to widen almost to the point of fracturing through. Similarly, the elbow x-rays on the bottom show a normal appearing x-ray on the right side, but on the left, there's widening of the growth plate on the medial epicondyle, which is where one of the important stabilizing ligaments attaches. For anybody who's heard of the Tommy John injury, the Tommy John surgery, that's basically where that ligament comes from. And so same kind of thing with that elbow kind of up in this position, that elbow ligament can get pulled on over and over and over and cause these stress injuries. So this is where, again, breaking the seasons up and giving kids a rest in between is advantageous to let them heal so that they're ready to play at their best when the next baseball season comes around. Next slide. Same kind of situation for overtraining can exist in female athletes. And there's a well-recognized correlation with female athletes having higher risk for stress fractures. They also have a higher risk for ACL injuries, though the absolute numbers tend to be more common in boys because more boys are competing in competitive sports. But girls relative to boys actually have a higher risk of ACL injury because of their mechanics and their body alignment. And so there are existing conditioning programs that have really helped decrease these rates if the female athlete is able to work on them ahead of time, especially for sports such as soccer. And on this picture here, we can see signs of a stress fracture in the femoral neck that has developed in a running athlete. These kinds of injuries kind of present as this nagging kind of pain around the hip, groin, or thigh. And so, again, injuries that are not getting better over time with rest is not something that we should be encouraging kids to just play through. It's really a sign that they have a pending problem and it really needs further evaluation. You can see these stress fractures around the hip, the foot, numerous areas, the tibia. And so really, if the pain is persisting more than several weeks, it's really something that should get evaluated to look for these kinds of injuries. Next slide. So of course, with the pandemic and decreased outdoors time, one of the things we've also seen is that there's been a large prevalence of low vitamin D levels. Kids have not been outside and exposed to the sunlight. And so something to really make sure that the kids are getting is adequate vitamin D and calcium supplementation if they're not getting it just within their diet. And so just in this chart, you can kind of see what the going recommendations are by age for calcium and vitamin D intake. And especially for female athletes, typically we even look for about 1,500 milligrams per day in the female athletes to make sure that they're getting adequate calcium. Next slide. Because especially for the female athlete, we see this problem with much more body consciousness, especially as we can see even in the Olympics right now. There's a lot of pressure on the female athlete to have a certain body type, a look, and so they're very conscientious about their weight, which can lead to disordered eating. And with the high intensity training regimens that many have, that can also lead to menstrual dysfunction, and this combination can lead to osteoporosis, and again, this higher risk of stress fractures that we can see. Next slide. And similarly with the obesity epidemic, there are additional things we see in kids that can be caused because of their weight that affect growth plates around the knee and around the hip. And so really encouraging healthy habits and managing the weight issues early on is encouraged, especially as we're coming out of the pandemic and kids have gained weight because they have been less active. Next slide. So thank you for all of your time, and if there's any questions, I'm happy to answer.
Thank you, Dr. Cunningham. We appreciate it, and thanks for this wonderful information. We'll come back to you on Q&A here when we get through the rest of the presentations. Thanks once again.
Great. Thank you.
This time, I'd love to turn it over to Dr. Powell to take us on to the next item.
Hello, everyone. Thank you so much. Next slide. As Dr. Cunningham already mentioned, PE and proper conditioning has been minimum for most kids during this pandemic and virtual learning. I know parents and teachers have made attempts to get creative with these activities, but for some kids, this also meant poor supervision and monitoring of actual movements behind the screen or inconsistencies. Although I'll be addressing this topic very generally today, it is important to keep in mind for everybody that returning to anything at all, whether it's school sports or other activities, looks and feels very different for each child and for neurotypical children than it does for kids with developmental delays, autism spectrum diagnosis, or a number of other genetic and medical conditions. We need to consider current functioning while taking into consideration what has happened and what actually hasn't happened for the past 16 plus months. A lot can change, as was already mentioned, physically, but also emotionally during that time. We need to address assumptions and adjust expectations, whether it's sports, academics, or anything else, and make the necessary accommodations before jumping back into sports, activities, back into the classroom, that sort of thing. So as you see on this first slide, I'm talking about Johnny, and I will be referring to Johnny for the remainder of the presentation. Johnny is a very good football player, and this was pre-pandemic. He was on his way to being the next Peyton Manning, and that's my choice, so we'll leave it at that. That was, like I said, before the pandemic, when he practiced a lot, he conditioned, he stretched, he did everything that Dr. Cunningham said is needed. He was motivated, his parents supported him, and were very happy to drive him to games and practices without any limitations. Next slide, please. So what I want to talk very briefly about is muscle memory, because that muscle memory may still help get Johnny back in the game, so to speak, or at school. And the procedural memory, that's the definition that I want to give you for muscle memory, is a procedural memory that involves consolidating a specific motor task into memory through repetition. So think about pre-COVID, where kids were playing, whether baseball or football, and they were practicing a lot and kind of built that memory into their brains, so they didn't need to practice as many basic skills, so that required less attention to a specific task and just focusing on bettering their game or being better at doing math because they already learned the basic skills. The other two types of memories, I just put them there for reference. So let's say Johnny hasn't played any games in terms of in person, except on his Xbox or his PS4. He doesn't quite have the PS5 yet because one of his parents lost his job during COVID, and money has been a little tight. His parents are arguing more, he's bored and frustrated, but he doesn't say much because he doesn't want to add to any more stress into the family mix. Next, please. He's tense. He's not playing. He misses football. He misses his friends. So even though he is tense, he's not tensing or relaxing his muscles like he is if he was actually conditioning or working out. He's learned a lot by watching athletes on YouTube and playing his games, but he's also snacked more and hasn't really worked out. Maybe he's got the back problems that Dr. Cunningham was talking about, poor posture, he's not doing what he was doing before. He still thinks he's quick and precise and that his throwing arm is as golden as ever as it was before COVID. His mind believes that his body hasn't changed. And as was mentioned, that's when injuries can occur. What his coach, parents, doctors, therapists, etc., need to explain to Johnny and help him work through is that getting back in the game may require, like getting back to being coordinated and judging distance well, may require more time and patience on the field or in the gym, that he may need to go back to basic training to condition his muscles, and more importantly, that it doesn't mean that he's incompetent, that he's not skilled, or that he's weak. So he needs to understand that visual processing, visual motor integration, coordinated movement may need some fine tuning before he can execute a perfect pass, for example. The brain is amazing, and we can retrain it and make new connections through something called neuroplasticity. So Johnny will be okay. He will be, if the adults in his life guide him and communicate with one another. As was mentioned, it's very important not to leave it up to kids who have high expectations or overestimate or underestimate their abilities to make all the decisions when it comes to playing sports or when it comes to going to school and integrating in different activities. Next, please. And I present the homunculus. This is a representation in the brain of how much space is actually dedicated to specific body parts and their function. I'm not going to linger on this slide. It's very pretty, but I'm not going to stay on it for long. But I will mention that thoughts, feelings, actions, attitudes, connections, beliefs, everything can affect positively or negatively our biological functioning. How well our bodies work depends on many factors, and as was already mentioned, that includes sunlight and vitamin D, good nutrition, hydration, all that. It takes a network of connections and different areas of the brain to get Johnny back to the field, to the classroom, to have him feel competent, and to do so safely while avoiding injury. And let's not forget what I mentioned about one of his parents having lost his job, which sadly adds not only to marital stress, but also stress on Johnny. In his 13-year-old mind, I think that's what I said, he's 13, he's probably interpreting reality in very different ways than his parents are. Some kids, maybe not Johnny, also have other barriers when getting back to school or sports. Next slide, please. So we have to be aware of everything else. We have to look at the whole child. We have to look at what else is influencing that child. The variety of movements, limitations, and interactions during the pandemic with others, for some limited physical space, poor nutrition, or simply how we use our breath in response to our task makes a huge difference. This transition means, for many, moving from technology like playing video games to remembering how to read and use our environment, how to exist in a particular space with others, practicing or learning social skills maybe all over again, remembering a thing or two about social etiquette. Additionally, children with developmental delays and other diagnoses may need even more time to switch to in-person activities. So I want you to focus on kind of what I have on that list there, but I will talk a little bit more about anxiety, because separation anxiety and social anxiety overall, worries associated with COVID or not, have actually increased over the last year. We cannot assume that all kids are fine. we need to make sure they're okay and ready to go back to whatever the challenge or expectation may be when they start school, whether it's in August or September. We don't have time to go into specifics, but conditioning and preparation for reintegrating or going back to sports depends on the type of sport as well. Are we talking about a fun recreational team after school with the goal of pure physical activity and physical movement? Or are we talking about early specialization where the athletes or kids engage in significant practice and time, like Johnny? Let's assume that's the track he's on. How do kids deal? Well, one, parents, coaches, medical providers, sports psychologists, rehab specialists, etc., the adults in a child's life need to be on their A game in order to make good decisions and help kids make good decisions about whatever they're involved in. And two, executive function skills, which I have there at the bottom of the slide, are very relevant to transitions, comprehension in general, and following through. So next slide, please. Let's pretend that this is the profile showing how Johnny is in terms of his executive functioning. This is something I use when I do testing. Overall, if you can look in the right corner, the overall score where it's in yellow, he is doing okay according to his parents. But if you look at specific scores in the middle where it says classification, and then on the right side where it says weakness or strength, they do have, what that means is the parents have to repeat themselves and make sure he's paying attention. They have to give him 2 instructions at a time, but no more than that, because otherwise tasks are not getting completed. Johnny also has some difficulties getting started on his homework or any activity, like just getting started. So what all this means is that getting back to school and on the football team may require going over rules, plays, assignments more than once. Even if Johnny gets back to playing with relative ease, remember muscle memory and neuroplasticity, it will take mental and physical energy to do well. So kids, especially at the beginning of the school year, will be mentally exhausted, which in turn places extra demands on parents' energies and time. Next slide. So remember the homunculus and the mind-body connection. This is just a nice code that kind of brings it all together. We need Johnny to feel good about his abilities, understanding why he has to go back to practicing basic drills, for example, why he needs to review his basic math before he can move on to the next class. And we want him to keep motivated. We also need Johnny's parents to work on their financial and emotional difficulties so that they can support Johnny and notice if there are any problems, changes in behaviors, injuries they're not reporting, other psychosocial stressors that may affect Johnny's well-being overall. How do we do all that? Next slide, please. First of all, for all of us, not just for the kids, one day at a time. Then we need to be present and aware, have a plan of action with enough time to execute or enforce, and to be patient. We definitely need to have patience as adults working with kids. This pandemic didn't change lives or routines overnight, so we can't expect kids to go back the way things were and be resilient and bounce back in a day or even a week. It takes time. An adjustment period of about 4 to 6 weeks is definitely typical, and it's okay, which means if your child or children who are starting school mid-August, we need to have a plan right now because there's not enough time, and we need to support them to transition back to school or into the sports that they're practicing. It's not all gloom. I know I said a lot of things that need to be worked on and a lot of things that adults need to do to support the kids. As providers, we need to be there, but it is not all gloom. Knowing the cost of not paying attention, not keeping communication open, and delaying actions is too great. It could lead to injuries, anxiety, prolonged depression, eating disorders, obesity, as was mentioned already, and other preventable conditions. And there's help no matter what the issue is. So I say all of us and everybody else who will have access to this should stay informed. We need to make sure that parents in general understand and stay ahead of policy changes and safety measures for going back to school or sports in person. And then decide if you as a provider or your child, your patient, or your student needs interventions or other supports. If, like I have here, specific symptoms like crying, severe separation worries, clinging behaviors, and other behaviors that are just out of character for the child we're dealing with or for Johnny, if those persist past the 6-week mark, please reach out and seek appropriate support from whatever the specialist or provider is who can give you the best advice or the best recommendations or referrals. So one, we are shooting for well-being, and second, for valedictorian and star athlete. And I would like to end with a more positive comment, because physical activity, when done right, improves mood and is a great way for children to develop good social skills, increase self-esteem and self-awareness, and improve motivation in other areas of their lives, like learning. It helps them keep focused, and it definitely helps with attention problems and minimizing stress. So with that, thank you so much.
Dr. Powell, really appreciate that. A lot of great information there. Just as a note, we will be sharing these slides with all of our registrants and folks that have signed up today. So once again, thank you for that information, really critical and important. This time, last but certainly not least, our final presenter of the webinar, Dr. Randhawa. Take it away.
Thank you very much. I'd like to thank the Long Beach Chamber and the audience for presenting us, and the audience for joining us. I think Dr. Paul and Dr. Cunningham really stated it well. It's mind, it's body. And I think the main takeaway for the slides I will go through, my main goal is to just create a level of awareness. I think all too often in disease states, we try to pretend it's not that bad. Maybe it'll just get better. And I think lungs in particular are notoriously difficult when it comes to that, because how do you feel and how your perception is of your symptoms is often variable. And so you can take an adult who has very mild lung problems and they'll feel very sick. And you have individuals like children who, for various reasons, can be extremely sick, and they will say they feel just fine. So my main goal today is to really talk about this level of awareness. Next slide, please. I will start and end with COVID. I think, hands-on, we've had an incredible amount of experience dealing with the coronavirus pandemic. We've had dozens of cases of COVID just in the last number of weeks at the children's hospitals. These are pediatric cases, and a significant number of adult cases as well, obviously, which we've had, personally have had experience treating on the inpatient hospital side. And I think the one question that I get asked, and we should really talk about, is that kids and adults who have asthma are actually at some of the least level of risk of this disease. I'll say that again. The patients you think would get the worst of this, if they have asthma, they should somehow be more susceptible, should be more sick. That is not the case. And we've seen this now for the last year and a half, and we've seen this globally. There are multiple studies just like these that have looked at thousands upon thousands of cases. And the question then becomes why? What is it about the asthmatic patient that allows them to not necessarily contract COVID, or if they get it, it's very mild? And I'll reapproach that at the end with some discussions about why that's the case. Next slide, please. So the main point here, again, there's a lot of information on these slides. I'm just going to talk at a high level, is understand that we are doing a lot for asthma. We have about 25 million adults in this country with asthma. We have about 8 to 9 million kids estimated, and that number is only going up. And the biggest problem here, in fact, the only thing that I'd like to really talk about here is the lower horizontal line. The fact that we're going from children to adults and the onset is highly variable. That's a big problem. And each of these other big boxes here are the different subtypes of asthmatic. So gone are the days when we say that an asthmatic is an asthmatic, it's the same. These are now very complex subgroups of data points. And those data points allow us to pick targeted therapies And in the end, that's better for patients. It's better for lungs as you age. It's better for kids who are trying to be athletic. It's better for kids who are trying to overcome other types of illnesses. Next slide, please. So one of the key components here in understanding asthma is, again, first and foremost, acknowledging awareness. A child who says, I feel fine, may absolutely not be fine. And the reason for that is a lot of the airway dynamics in these pipes of the lung. The lung is very complex. It starts off with one big pipe and then it starts to split. And as you grow as a child, it splits up to 23 to 25 times. Imagine that it's like a web that starts to go out. And the smallest pipes, when you finally get out there, are just a millimeter to 2 millimeters big. Now, if these pipes start to swell, they start to get irritated, they start to produce mucus, airways can go down, and they can go down pretty quick. And it's very important that we recognize what gets inside of the lungs, what we're actually breathing in, and those factors really contribute to how this disease starts to prevail and starts to become more prevalent. Next slide, please. So the concept I always try to bring forth to folks is, we can say we feel fine, but doesn't mean we are fine. So imagine, living your life and you believe that you are healthy. And I hear that all the time from patients, and I'm the healthiest person around. I haven't had to see a doctor in 20 years, right? That infamous quote. The reality is you may feel fine, but as to Dr. Cunningham's point, if your bone density is low, you're not going to know until you have a fracture. So better know what your vitamin D levels are. Look at your calcium intake. In this case, we are now to a position here in this country, and in this sense, Europe is already ahead of us, where they're screening every single child for asthma. That's everybody, any kid above the age of 6, and they're screening them. We're not quite doing that here in the US, but the reason why Europe took that approach is because they figured that they are missing so many patients. If you're waiting for them to start to wheeze and cough and get into trouble and end up in the ER, we're actually missing a large portion of those patients. And it's very important that we start to capture these patients early because we don't want them to lose lung function. That's another point I'm going to keep coming back to here in the next number of minutes. The lungs that you have by the time you get to be 18 to 20 years of age, that takes literally 18 years to grow and develop. After 18 years of age, you kind of have those lungs for about two and a half decades, and you start to lose your lung function as you age. So it's really critical that we diagnose individuals who have lung problems early, maximize their lung function so they hit those adult years cruising along, and they have the highest lung function when they're in their 40s, so that as they have that natural decline, they do just fine. So it's important to recognize that symptoms do not equal disease when it comes to this condition. Next slide, please. So in the inside of a lung, these are examples of bronchoscopies or scopes that we have performed on our patients. We have one of the largest asthma centers in the nation here at Miller's in Long Beach. On the left side, the same lung. On the right side, the same lung, same patient. So you can see the difference, what happens when the airway swells up. This can be caused by smog, particulate matter that's in the air. This can be caused by pollen. This can be caused by dog or cat dander. So many factors come into play, but imagine the difference there. The swelling that's there is significant and serious. So you don't want to wait for it to get that bad before you decide to take action. Next slide. So inside that system, what caused that red swelling that you saw is a very complex set of immunological communication. In fact, these are the same types of terms, the terms on the right, such as cytokines. These are the terms that you heard about in COVID. So what COVID did is it hit individuals who did not have asthma. They actually had relatively, quote, normal lungs. And it caused a storm effect, different types of communications that are occurring that are unhealthy, that do not promote proper lung function. And in this case, you see that here very clearly, that these are just a few small number of these pathways. And again, I take you to the bottom of the slide where it's this acute, subacute, or chronic format. And what we don't like to see are patients who are turning from an acute state to a subacute state to a chronic state. Once they hit chronicity with this type of inflammation, their lungs have a very difficult time reversing themselves, and that can turn into a long-term adult disease. So children who have this disease can continue to have this problem well into adulthood. Next slide, please. Again, just an example of what a scope looks like in a very young child. This was in a child who's only 2 years old. So again, it can be incredibly red, again, full of blood, engorged, and it could turn on, and it doesn't turn on in a matter of seconds, it turns on in a matter of hours to days. So again, we like to avoid these situations even though we deal with this on a regular basis, we can do that as long as we recognize the disease and treat it with the most advanced techniques. Next slide, please. Indeed, lung function can be impacted so significantly when we have patients who end up in the ICU or in the emergency room. They can collapse an entire lung. That's what the x-ray looks like in a young child, where an entire lung is collapsed. This is an asthmatic. And when we went inside the airway, the disease state actually turns into plastic plugs. These mucus plugs that you see on the right side are actually so thick they have to be removed with forceps. So they're literally like rubber, and that occurs over time. So this is not something that suddenly happened to this child. This is a chronic disease state. And indeed, of those 8 to 10 million children who have asthma, this is probably about 8 to 10% of them. Next slide, please. So there are many things, many things that you can do to try to improve your chances of not having chronic long-term asthma. However, there's some things that you simply cannot avoid. We cannot control the air in our environment. We cannot control pollution sources. We cannot control some of the pollen effects that are out there. So as much as we make some mitigation measures, as much as we do all these things right, the reality is there's certain things that are outside of our control. And this is what is the difficulty of this disease. And indeed, when we try to look at this more from a natural standpoint, what else can we do? Can we exercise more? Can we do other things? The answer is it's really difficult to know that a single effect can have what we expect to see on those different subgroups of asthmatics. So what's been happening in the last 5 to 10 years, as we've been part of this at a national level, is we're developing very much precise, organized approaches to asthma care based on individual subgroups of patients. That's kind of a large data model and data approach. Next slide, please. And what we do is we try to target individual things that can really make a patient upset. These are microscopic, electron microscopic views of things that you all and myself breathe in every single day. This is pollen. These are ragweed, there's timothy grass in there. These are different things that are the size of microns. These are things so small that they're the size of dust. And we're breathing this stuff in every single day. It's actually getting worse over time. Next slide. This is an example of dust mites. And these little things are in your bed, they're in your carpet, constantly triggering asthma. Next slide. This is an example of cat dander. And indeed, there's a lot of cat dander out there. Even if you don't have a cat, you're going to be around somebody who does. And these little tiny particles can get inside your lung. Next slide, please. And it causes problems down at the tiniest levels of the airways. And again, as I show you this on the left side, you can see how many branches of those airways can be problematic. So if you start knocking off these branches in these ways, it actually makes it very difficult to reverse this process and make their disease state better. Next slide, please. So essentially what we try to do is target disease state. This is an example of different types of inhalers that we use. And these inhalers allow us to target the micron, the very smallest levels of the airways, especially for young children. It's a very important concept. Next slide, please. The next series of slides talk about the newer versions of treatment that we have, which, believe it or not, are not things you inhale. These are either pills that you take or injections that are given. So much like the world of rheumatology, if you've heard of psoriasis or rheumatoid arthritis, they no longer inject the joints directly. They actually go ahead and give them a shot in the arm, and it modifies the immune system. It hits these types of targets. Next slide, please. The series of drugs that are listed here are approved now 6 years old and above. These are excellent drugs, and you can see just in a quick view here of how much it improves lung function. It actually can improve lung function very significantly. These drugs have been around for a very long time now. Next slide. We have an entire center that's basically dedicated to this here at Miller Children's at the Village. We're taking literally hundreds and hundreds of these very severe cases, and we're shifting them to a point of control. Next slide. These are the types of drugs that are studied at a national level because we're a nationally accredited center. We can have access to these things very early. We can use the best data points around, and we can actually take their lung function and improve it not by 1 or 2 points, but sometimes up to 10 or 20 points. Pretty significant shifts. Next slide, please. And so what I'd like to kind of wrap up here with is understanding that if we don't target these things in a highly data-centric way, we can't achieve the endpoints that we're looking for. Next slide, please. And one other key point is that other things start to impact your lung function as you get older. These kids who have asthma tend to get sick more. They tend to get pneumonia more, not only as a child, but as an adult. Next slide. That does not help them long-term. It causes kind of this chronic severe disease state where if you look at the slices of their lungs, it looks pretty severe. These are the things we're trying to avoid. Early action counts. Next slide. So essentially, we're in a position where we're trying to avoid this. I'm not going to spend too much time on this, but this is basically the endpoint we're trying to change. We are checking cholesterol levels on kids now when they're 9 or 10 years old to prevent them from developing heart disease 20 to 30 years later. We are now seeing asthma turn into COPD. These are patients who will never smoke, never have occupational health hazards, and they will develop severe obstructive lung disease. We have to address this early, and we have good outcomes at the end. Next slide, please. So essentially, this is a highly funded area. In fact, out of the top 10 drugs ever pushed out in the world, the majority of them are asthma-based medications. We have to still do better because we're not making these patients as healthy as possible. Next slide. So our job here as a, kind of an advanced system is to take big data, connect people together. We're building these things here at Miller's. Next slide. And we're able to get these things out at a national level. We are an Asthma Center of Excellence, one of the very few in the nation. We're linked up everything from the community to the specialty side to the ICU and beyond. And this allows us to predict and understand better how to take care of these patients and have the best possible outcomes. Next slide. We are ranked, obviously nationally, we'll take credit for that. It's been a lot of hard work getting there, but we continue to push forward here. We have a large growing division. We have a combined focus on immunology and pulmonary. And indeed, we even focus on super specialty diseases like cystic fibrosis and others. My last slide, next slide, please, is a set of questions that I get commonly asked, which will probably overlap into our next section here. So I'll try to answer these quickly. So for kids who have asthma and are going back to the world of sports, how should they prepare? I would literally go back to what Dr. Cunningham referred to. It is all about conditioning, but you can't condition your system, your lungs, unless your lung function is normal. So if there's a child who has any type of lung problem, they should get evaluated. They should get lung function testing before they go out there and push themselves. If you look at athletes should have supernormal lung function. And if they're starting low, they can have pretty significant problems. Second question here is, if there was a disruption of care during COVID, did that compromise asthma management? Absolutely, yes. We saw our volume of asthma patients drop by 90% for the better part of 8 to 10 months. And then what happens? We start to see pollen counts go up, we start to see smog levels go up, and all of a sudden we have all these patients in the hospital with asthma. That's happening right now. So we do encourage our patients to actually come back. Asthma is not a risk factor for contracting COVID. Obviously, vaccination is key here, but we want to get to a point where our patients are back in, their lung function's managed, they're on the optimum set of medications, and then we can get them right back into sports in a safe, properly conditioned way. The last question I'll answer is, how important are flu and COVID vaccinations as they become available? Right now we have this Delta variant. It's a very simple thing, folks. It's called vectors. It's called transmission vectors. The more transmission vectors available, meaning those unvaccinated people, the longer this thing stays around. Anybody over 12 should get vaccinated. 6 and above vaccines are likely to show up around January. That's the anticipation, with a 10 microgram, very small dose exposure, which may be up to 3 doses, but our anticipation is that's the case. Everyone who's able to get vaccinated, and that is literally the majority, if not all people, should get that, including children. So I'd like to thank you for your time. I'm sorry I went over by a couple minutes, but we'll take some questions.
Dr. Randhawa, no, not a problem. Wonderful information, very timely, of course, as well. We'll get these questions kicked off as we get the other doctors to queue back up and rejoin us here during the webinar. But I'll stick with you, Dr. Randhawa, as the doctors come back on. You talked about this, I think, in the beginning of your presentation. You touched on a little bit about, the people that are asthmatic. We thought they would be the ones most susceptible to get COVID. So one of the questions that's come up here from our audience is, how do parents distinguish the symptoms of COVID, asthma, allergies, and the flu? Can you describe some of that?
Sure, absolutely. Let's start off with the most serious thing first, right? COVID is the most serious thing, and we want to be cognizant of that. So let me split that into 2 groups. If you're a vaccinated individual, I'm talking to 12 and above, 12 to 21-year-old who's vaccinated, you have about a 1 in 25,000, I'll say that again, 1 in 25,000 chance of getting active COVID disease, meaning you somehow got vaccinated. You have a 1 in 25,000 chance of having symptoms. Those symptoms are very different, typically very mild. They tend to last about 7 to 10 days. low-grade fever, they do not lose their sense of smell, and they tend to cough, and the mucus is productive. They actually produce actual mucus. So long kind of run of symptoms, and then around day 7 or 8, that's when people typically get tested. Versus asthmatics, who will typically flare within a matter of 12 to 24 hours of exposure. So you're looking at wheezing, you're looking at very acute set of symptoms, and that is the typical model. Flu, influenza, obviously is something that has high fevers, significant body aches, and we are about to hit a flu season here in a few months. So we anticipate that we will see a significant amount of influenza this year compared to last year when we had very little. And then there's the last group of the unvaccinated patients. And interestingly, with the Delta variant, we are seeing that the unvaccinated patients, who also are very young, are showing up with a significant amount of lung symptoms, meaning they're having chest pain. They are really short of breath. There's a difference between being wheezy, having wheezing, and feeling like you can't breathe. And they feel like they can't breathe because their oxygen levels are low. And again, for the unvaccinated folks, that's something you want to jump on very quickly. You want to seek emergency care very quickly and get that under control. So that's how I typically organize that question.
Great, wonderful. Appreciate you doing that. Some really great key points there. Let me change it up just a little bit and jump over to Dr. Cunningham. Dr. Cunningham, you talked a lot about youth sports and youth sports injuries that may come along with that. And as you know, folks are back out there, it being summertime, especially here in Southern California. They've officially reopened. A lot of places have, that is. What are some general recommendations you can provide to parents and coaches to kind of reduce those risks of some of the common injuries that you had talked about, or even re-injuring oneself?
Yeah, so again, I think as we kind of presented earlier, the conditioning going into your sport is really critical. If you are playing soccer and you just show up onto the field and expect to go play 3 games in a tournament that weekend, you're not going to be able to play at your best performance because you're out of shape. You're going to be tired, exhausted within 30 minutes of that game. And so because of that, you're not as focused. You're just trying to move up and down the field, and you're much more likely to get injured as a result of that. So that conditioning is really critical because, just as Dr. Paul kind of said, you have that muscle memory. You don't have to be focused on just making your body move up and down the field back and forth. You've already taken care of that work by preparing yourself with your conditioning ahead of time. You're now focused on the fine details of, I need to get over to this part of the field to make that cross, or to grab this ground ball, and you're really focusing on the actual sport activity rather than just how tired you are. So the conditioning part, the stretching is also a big part of that, because again, if you're tightening certain muscles, and again, the hamstrings are just the one I see over and over and over, you don't have that flexibility to bend and make that catch, or slide in to make a tackle in soccer, you name it. And so those are, again, the risk factors for a lot of injuries we see. So that preparation work going in, and so coaches knowing that ahead of time need to kind of be able to take a step back, assess where their players are at the start of the season, and say, do I think they're really ready to be doing full speed practice, or do we need to kind of ease into this and make sure that everybody's at the level they need to be before we kind of blast into full speed ahead? A lot of kids are getting ready to go into 2-a-days for football in a few weeks, and so if they haven't been conditioning, they're going to really struggle, especially in the kind of August heat. And the hydration issues and all that we see time and again with kids suffering heat exhaustion. So that conditioning, again, decreases the risk of that heat exhaustion. But hopefully most of the coaches are, again, pretty well tuned in on this for things like football, where they will maybe start the first week, no pads, no helmets, and just working on the conditioning, doing drills, and then progressively adding these things, the helmets, then the pads. Because again, all that equipment really weighs a lot. It causes a lot more sweating. So the heat stroke, heat exhaustion is a big problem, especially for football coming in at this time of year.
Perfect. Dr. Cunningham, thank you for that. And, talking about physical activity and keeping one healthy during physical activity is important, but just as important is the mental health as well. So Dr. Powell, this question is for you. You know, physical activity, social connections, all of that is important for your mental health. And due to COVID, obviously, a lot of the children have lost those connections to essentially, you know, keep their mental health healthy. How do we help our kids connect with their peers who haven't seen or just going to get ready to be seen here, whether it's this summer and or back into school?
I really believe preparation, which has been said across all these three disciplines, is necessary, and having a plan, and definitely not starting where everybody left off, just saying you had a birthday party pre-COVID, and then that's where you're going to start, and you're going to be overwhelmed visually and physically with all these peers. So I think for parents to understand what that means, knowing their own child, teachers and coaches educating and being honest with the kids and the parents will help a lot with the socialization piece, gradually getting everybody back into a routine, having some structure to begin with, whether it's, you know, going to bed instead of midnight or 1 o'clock or whatever the case has been with school for the past couple of months, to slowly going back to bed at a regular time so that they have enough sleep. When they wake up in the morning, they are mentally ready to tackle on the day, whether it's to just go to school, just have a conversation with a coach, meet up with peers and talk about sports in school, or to be able to function without getting a headache, without getting exhausted, without having breathing difficulties, whatever the case may be. So I think planning and education are definitely essential to moving forward, having platforms like this and distributing information so that as many people as possible can benefit from information, whether it's from us or others, I think will be detrimental in making sure that kids go back safely and we don't see anybody coming back with more injuries or other diagnoses. I mean, I know there are high numbers of anxiety, depression, suicidal ideation, all of that is there, but we can handle it if we prepare the parents and if everybody is truly honest about assessing and demonstrating what's needed.
Most excellent. Really appreciate that. We appreciate all three of you. We're running out of time here, and I know there's some other questions here, and we're going to get that answered when we do our follow-up after this webinar. But I need to take a moment and thank all three of you for the time today and the wonderful information you've shared. You know, we've got a couple other questions here. You know, why is the chamber, why is the business community so interested in, you know, the kids back to school? And it's very simple. We want our employers to make sure their employees and their families are well taken care of. If they have to miss work, the local economy stops. Even more important is we want to make sure the community that we're all in and all serving stays healthy. And a lot of the pointers today are certainly assist with that. So we believe at the Chamber, it's our job, just like anyone else, to provide this information and get it out there. And the three of you have helped do that for us today. So I want to just say on behalf of our leadership and our businesses, thank you to all three of you for taking time out of your busy schedule and providing the information today to our members. We really do appreciate it. For more information regarding Miller Children's and Women's Hospital of Long Beach, please contact Martha Gonzalez via the information that'll be up here on the screen. Also, we'll include that in the recap that'll go out to the registrants today. In addition to their website, there's links to access several resources regarding the topics that were discussed today, as well as some of the links that are in the chat as well that you can grab. We thank you for joining us. We hope this was beneficial to all of you, and we'll be seeing you in the near future, hopefully back in person, along with some more webinars of some more important information data that we can provide to all of you. Enjoy a wonderful Chamber of Commerce Day today. Thank you so much, all.